Okay, now we're going to talk about different support options for individuals who are experiencing substance misuse. So, people with substance dependencies may require extra support for coping with withdrawal symptoms and cravings. There are many different types of options for this. It could be inpatient and residential programs, and these are really nice because they can provide constant supervision and help remove some of those daily triggers. There's also non-residential options that tend to be less expensive. So things like 12-step programs, these have been shown to be really, really effective for those who are willing to participate. It's also important for us to understand that there's this kind of like a level of shame and stigma surrounding substance misuse and substance dependency. So, feelings of embarrassment and shame may motivate people to hide their behaviors. They can deny or maybe even downplay their importance or avoid dealing with problems associated with them altogether. So, as health coaches, we need to do our best to suspend judgment and really let our clients take the lead in discussing those behaviors. The better rapport you build with the client, the more trusting you can make them feel, right? The more open you can kind of get them to be, the better. And so it's really important that we don't have any judgment and that we really kind of create an open space for them to share this information. So, shame may make clients prone to reactance or doing the thing a person has been told not to do. So, that's what the term reactance means, right? And it comes from this impulse to restore behavioral freedoms and that are perceived to have been threatened or lost. So, essentially, it's like that forbidden fruit, right? Forbidden fruit is sweeter. When you tell someone they can't do something, they have a desire to want to do it more. So again, that's this term reactance, is when they are wanting to do something that they've been told not to do. So as a health coach, we really clearly are not telling them not to do something. You shouldn't do this. Because again, when you tell them to do that, it's this reactance, they're going to want to do it even more. It needs to come from them, okay? So this is where, as a health coach, we can use some of these appropriate behavior change theories and methods that we've already learned to help them, again, not telling them not to do that behavior, but to help them to realize maybe that it's not best suited for their values and for their goals. So we can use the OARS technique, we can use stages of change, the trans-theoretical model. We can use applying some of those self-determination theory components, so autonomy and relatedness and competence. And then also really important that we build self-efficacy for change. So those are some of those methods and behavior change theories that we can use with a client who is trying to kind of navigate their substance misuse. There are other useful behavior change therapies that are kind of outside the coach and client relationship. So coping skills training. Teaches cognitive and behavioral skills to improve their ability to cope with situations in which substance misuse is likely to occur. During this kind of training, people will learn new response to stimuli that will provoke the undesired behavior. So essentially, we know it's going to happen. How are we going to best cope when this happens, right? And then cognitive behavioral therapy, you probably remember hearing about cognitive behavioral coaching. We went over that, but there's actually a therapy that's related to it. And this helps individuals become more aware of their thoughts and their patterns, their behavioral patterns that promote the substance misuse or other negative behavior. So when they go through CBT, people are going to learn new ways of thinking and responding in high-risk situations, and it typically addresses the immediate behavior change as well as the long-term relapse prevention, which is really, really important. Family therapies can actually be really, really important, especially when it's revolving around substances that involve patterns surrounding the family dynamic. So this includes alcohol use disorder. Brief behavioral interventions. So some individuals will actually do really, really well in changing substance misuse behaviors with only a few sessions with a physician or a health coach or some other provider. And they can use multiple different types of techniques, whether it's behavioral counseling or motivational interviewing. But these, what we call brief interventions, can actually be really helpful for some folks. And then there's always self-help programs, and this can take the place of books, right? This could be online material. It could be some other media that they're using. And really all of this will help them with goal setting and self-monitoring and then other behavior change skills. So these are some of those kind of helpful behavior change therapies that are kind of go outside of just the coach and client relationship. So there's been a lot of research on substance misuse and behavior change, and what we found is that there's some kind of core components that we know are going to help people become successful when it comes to behavior change programs for people who are dealing with substance misuse. The first is social support. Then we have structure and goal setting, rewards, Norman models or behavior change success, improvements in self-efficacy or behavior change, and developing coping skills. So those are some things that are really, really key in success in behavior change for people who are dealing with substance misuse. So let's do a little learning recap. What are some extra support avenues for those coping with withdrawal symptoms and cravings? What should the health coach consider related to shame and guilt when working with clients who are experiencing substance misuse? And then lastly, what does the term reactance refer to, and how might a health coach prevent this? I'll pause here and I'll see you for the next lecture.